in children is a frightening experience for the mothers. Despite having a good prognosis, febrile convulsion is a very difficult condition for parents to handle. Concerns about the future health of the child are the most common cause of fear among the parents. Sources of concern include fear of the recurrence, mental retardation, physical disabilities, and even death.
Your doctor in the pediatric emergency room in Sadie Hospital. You have to explain to mother about febrile convulsions. Good luck. I hope this helps her.
I am your doctor. I want to explain facts to you about febrile convulsions.
Jessica walks into the room and introduces herself. Mark's parents are polite, but are visibly anxious and worried. Mark is standing happily in the hospital crib. He points at you and smiles at his parents when you walk in. Pleased that he seems to be stable, Jessica proceeds with asking his history.
I am your mother. Help his, please. I have many questions. What are febrile seizures? Febrile seizures are seizures or convulsions that occur in young children and are triggered by fever. Young children between the ages of about 6 months and 5 years old are the most likely to experience febrile seizures. This risk peaks during the second year of life. The fever may accompany common childhood illnesses such as a cold, the flu, or an ear infection. In some cases, a child may not have a fever at the time of the seizure but will develop one a few hours later. My son started getting a runny nose and cough 3 days ago. Starting yesterday, he developed a fever that they controlled with acetaminophen. His appetite decreased, but his drinking and urine output remained normal. There was no vomiting, diarrhea, or rash. When did the convulsions begin? Mark awoke this morning with a fever of T38.7 degrees Celsius axillary and was again treated with acetaminophen. However, as I was getting him dressed, Mark started having full body shaking with jerking of both his arms and legs. The movements were rhythmic and he seemed out of it. His eyes were stared straight ahead, and I and my husband did not notice any facial or mouth movements. He was still wearing his overnight diaper, so we are unsure of any bowel/bladder incontinence. They did hear some grunting, but there was no change in his color. The entire episode lasted about 1 minute and Mark was sleepy afterwards for about 30 minutes, during which I had brought him to the hospital. He is now back to his normal behavior. Most often during a febrile seizure, a child will lose consciousness and both arms and legs will shake uncontrollably. Less common symptoms include eye rolling, rigid, stiff limbs, or twitching on only one side or a portion of the body, such as an arm or a leg. Sometimes during a febrile seizure, a child may lose consciousness but will not noticeably shake or move. What is about fever? Most febrile seizures last only a few minutes and are accompanied by a fever above 101 degrees Fahrenheit, 38.3 degrees Celsius. Although they can be frightening for parents, brief febrile seizures, less than 15 minutes, do not cause any long-term health problems. My pregnancy and birth history are unremarkable. He is previously healthy with no history of seizures, head trauma, or meningitis. He is not on any regular medications, has no known drug allergies, and his immunizations are up to date. He is developmentally normal for his age. Are febrile seizures harmful? Have you had anything like this before? No. This has never happened before. Well. What do you say about family, if there were seizures in family? How is development? The family is not consanguineous. There is no family history of developmental delay or metabolic disorders. Mark's maternal uncle had febrile seizures as a child but grew out of it. Mark currently attends full-time daycare while we are at work. I will try to examine Mark on a bed. Let's go. Well. Mark is alert and looks well. Not dysmorphic. HR 110, OR 25, BP 85 55ths, O2 SAT 99% INRA, T38.5 degrees Celsius AXA triage, now T36.3 degrees Celsius after acetaminophen. He has some nasal congestion with an erythematous throat and tympanic membranes bilaterally. Chest is clear. Pupils are equal 4 mm and reactive to light. He is normal tone and reflexes 2+ throughout. He is active and playful with normal gait and no neurological deficits. Your question: if are febrile seizures harmful? The vast majority of febrile seizures are short and do not cause any long-term damage. During a seizure, there is a small chance that the child may be injured by falling or may choke on food or saliva in the mouth. Using proper first aid for seizures can help avoid these hazards. There is no evidence that short febrile seizures cause brain damage. Large studies have found that even children with prolonged febrile seizures have normal school achievement and perform as well on intellectual tests as their siblings who do not have seizures. Even when the seizures last a long time, most children recover completely. The most important question that needs to be answered in a child with a febrile seizure is, what is the cause of the fever? Even if the seizure is over, any young child who has a seizure with fever should be seen by a doctor to make sure they do not have a brain infection, such as meningitis. I determined based on his history and physical examination that Mark most likely had a simple febrile seizure due to most probably viral infection. I suggest that this does not need any investigation, such as blood work, lumbar puncture, EEG, and/or head imaging is warranted. What kinds of questions do you have for me? How are febrile seizures treated? Febrile seizures cannot be prevented by giving the child lukewarm baths, applying cool cloths to the child's head or body, or using fever-reducing medications such as acetaminophen or ibuprofen. Doing these things may make a feverish child feel better, but they do not prevent febrile seizures. During a seizure, place the child on his or her side on a protected surface and watch carefully. Keep track of the time. If the seizure lasts longer than 5 minutes, call 911 or take the child to an emergency room. What do I have to do during a seizure? Remember, for most seizures, basic seizure first aid is all that is needed. The steps are simple, and anyone can do them. We will give you our brochure about a treatment of febrile seizures. Thank you. What's the outlook? Among children who have their first febrile seizure before their first birthday, half will have at least one more. Among children who are older than 1 year when the first seizure occurs, about 1 in 4 will have more. The long-term outlook is excellent, however. The vast majority of children with febrile seizures do not have seizures without fever after age 5. If you have concerns about your child's febrile seizures, consider consulting a pediatric neurologist.